Hi, everyone. Welcome to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and the host for the Dean's Chat podcast. I am joined today with Hall of Famer Dr. Warren Joseph, a tremendous leader in our profession. I'd like to read a short bio on Dr. Joseph so we don't miss anything, because what we're going to talk about a lot today is what makes Dr. Joseph tick as opposed to his history in the profession. So Dr. Warren Joseph is a specialist in the treatment of lower extremity infectious diseases. He received his podiatric degree from the William Scholl College of Podiatric Medicine. Dr. Joseph completed his postgraduate training at St. Joseph's Hospital, and uniquely, he did a fellowship in infectious diseases at Hahnemann University School of Medicine in Philadelphia. He is currently an adjunct clinical professor at the Arizona College of Podiatric Medicine, which I'm sure we'll talk more of in a little bit. Dr. Joseph is a fellow in the Infectious Disease Society of America, and he's an author of the IDSA Diabetic Foot Infection Guidelines. He is certified by the American Board of Podiatric Medicine. He has served for it's almost 30 years now.
Yeah, 30 years. 32 years now.
Oof. As the editor of the Journal of the American Podiatric Medical Association, Dr. Joseph lectures extensively, and his presentations have focused on the treatment of bacterial and fungal infections in the lower extremity. He's authored close to 100 articles, and he's no stranger to anybody in podiatric medicine. Welcome to Dean's Chat, Dr. Joseph.
Well, thank you very much for that introduction, Jeff. It's very kind of you. Of course, I wrote it, but I do appreciate it. And we do have to clarify that by Hall of Famer, I mean, that's the Podiatric Hall of Fame. I am not playing baseball. I'm not, making that sort of money. It's strictly podiatry, which was actually a great honor. And I also have to say, I'm really honored to be here and to be included, but I don't know what we're going to talk about because I've listened to a number of your podcasts. And for instance, I wasn't a prisoner in Iraq like Dr. Dahir. I haven't produced shark movies like Dr. Rogers. So I'm not really sure that I'm the right person to be here, but hey, let's see how it goes.
Sounds good, Warren. And it's fireside chat, kind of Dean's Chat theme, so we go by first names.
What's your last name?
Can't remember.
Absolutely. Yeah, I always go first name.
All right, sounds good. I'm not worried about topics, Warren, because I got a list of things we're going to talk about today that really some of it doesn't have anything to do with podiatric medicine.
Oh, okay. That should be fun.
All right. Well, hey, I want to get started with something that I think is just to set the stage. When did the famed Dr. Warren Joseph say to himself, I'm going to go into podiatric medicine?
Ooh, that's, I think my story's not unique. I got into podiatric medicine because I have a foot fetish. I'm just kidding. I mean, I'm sure you've heard that over the years.
I have.
And we used to get that all the time. It's like, why do you want to become a podiatrist? You have a foot fetish? No, actually, the reason why is very similar to what I hear when I'm doing admission interviews for students at the Arizona College, that they've either been born into it, so they have a family connection into it, or actually more likely than not, they have had an experience with a podiatrist personally for a foot problem. A lot of patients are athletes, or a lot of these applicants are athletes, and you wouldn't know it by looking at me now, but I was an athlete. I was a shot putter all through high school and college. Talk about glamorous sports. And we really got the women with that sport. And what would happen is that I would have some foot problems, and I started going to a podiatrist that my parents had gone to. I remember her name, Dr. Helen Zubrow. And that's my first exposure to podiatry. And I always knew I wanted something medical. And this was a unique field. I didn't really know much about it. I started doing research into it and decided, hey, this really looks great. And I was an undergraduate at the University of Pennsylvania, and I went to the pre-admissions advisory people, and I said, what can you tell me about podiatric medicine? I said, this is Penn. We don't have people go to podiatry school. Uh-huh. We only have them go to medical schools, MD schools and DO schools and vet schools. So I actually had to do the research on my own. I never went back to the pre-health advisor people. But the more I researched, the more I spent time with Dr. Zubrow and some other podiatrists in the Philadelphia area, the more I realized what an incredibly interesting profession it was.
Very good. And then how long did you apply right away to podiatric medical school? And did you look at the various colleges, or how did you do that?
Well, I never applied to an MD school or a DO school.
Okay.
I knew I wanted to go into podiatric medical school. And back in the day, it was a lot easier because, we're talking 1978.
Okay.
Yeah, I'm up there. And we only had 5 schools.
Right.
So I think I applied to maybe 4 out of the 5. I don't think I applied to the California college. And what ended up happening is I got interviews at the different schools. And I ended up choosing the Illinois College of Podiatric Medicine. Now, of course, the William Scholl College. For 4.5 years I was there, it was the Illinois College. And the reason why is because I remember sitting in, and I'm born and raised Philadelphia, and again, went to Penn undergraduate. And I remember sitting in on the interview at the Pennsylvania College, and it was this circular table, and I was at one, in the middle kind of, and all these people were firing questions at me. I was like, oh, wow, okay. And then I went to the Illinois College, and what happened is they were doing remote interviews. They came to like the Newark airport, a hotel at the Newark airport. And I went up for the interview, and I met 2 of their professors who interviewed me. I got the acceptance letter, and I figured, well, I'm born and raised Philly. I've always been in Philly. It's time to go out somewhere else. So I went and visited the school in Chicago. And I will never forget, after the tour of the school, I was introduced to the anatomy professor, Dr. Dan Bereither, his name was at the time. And Dan said, when you're done your tour, just come on back and we'll talk. And I sat in his office with him for probably an hour. Wow. Just talking about life in general, podiatry, Chicago. And to this day, I credit Dan Bereither with having been the person that got me to go to the Illinois College. In the meantime, the Pennsylvania College, I didn't hear from them. The Ohio College, I wasn't hearing from them. And I just said, you know what, it's time to spread my wings, go to another city, and go to a different school, and a school that really seemed to care. And that's what I found at the Illinois College. And I think that's, you didn't ask the question, but I think that's what our students at the Arizona College see also. I mean, we care about our students, and they seem to sense that. And even when we're doing the interviews with them, it's all about learning about them and hearing, their life experience and what they want out of the profession. So I still, to this day, think that's really the reason I went where I went, and try to still influence students today when I'm interviewing for AZCPM.
I agree with you. And that's such an important part of getting the students to feel like they're connected. And, this is a little bit out of order what I was going to discuss, but I'll never forget 6 years ago, I heard that you and Judy had moved to Sedona. Mm-hmm. It took me about 2 days to jump in the car and drive up and say hi. And we went out for lunch. And since that day, you've been involved with the college. You oversee the course on evidence-based medicine.
Right.
You do a lot of the interviews. You've been very instrumental in our strategic planning. Warren, we really appreciate it.
No, thank you. And I enjoy doing it. I mean, I've been in academia my entire career. I did 15 years at the Temple School of Podiatric Medicine, full-time faculty. I've started and run residency programs. I've always been involved with either student or resident education. And that, to me, is one of the most important things and one of the highest callings is education. So I was pleased when you came up and met with us. And I've known you before that. But, I was doing a couple of lectures on infectious diseases in one of the courses. But to be invited to actually officially join the faculty was really a great honor. And to this day, I really appreciate it.
Well, we've certainly enjoyed having you, and you bring a lot to the table. There's no doubt. So thank you.
Thank you.
So I wanted to talk about your residency program as it led into this fellowship experience that is very unique in our profession. Do you mind commenting on that?
Sure. This is going back 1982. I graduated from, of course, then it had turned to the Scholl College, and I decided to go back to Philadelphia. I was offered a 2-year surgical residency program at what's called St. Joseph Hospital. It's now long gone. It's an apartment building now. And I got the residency program, and at the time, only 50% of graduates got any residency program, and there were probably only 3 or 4 surgical residency programs, or two-year residency programs in the country. So I was set. I mean, I was going to become this great podiatric surgeon. I was going to train, and we're talking about top people. I was fortunate enough to train under Harold Vogler and John Buchholz, and just some incredible people who were the top surgeons at the time in our profession. And I thought I was a pretty decent surgeon, but I also found that I would have to kind of push myself on some of the other medical specialties to learn a little bit. And at the time, we had rotating at St. Joe's Hospital the ID staff, the infectious disease staff at Hahnemann University Hospital. And the chief of ID was Dr. Jack Lafrock. Now, Dr. Lafrock was a bit of a maverick in the ID world, even back then. And he always would take the residents on rotation. And he would buy us lunch. It wasn't that huge. Lunch was subsidized, so it was inexpensive. But we would sit around the table and we would just talk about things. And one day between my first and second year, we were sitting there and talking. He said, you seem to be really interested in infectious diseases. How about at the end of your residency, you come and join us over at Hahnemann?
Wow.
Yeah, and my mouth kind of dropped to the table. I said, you're talking like a fellowship? Because that was unheard of in podiatry. There were no fellowships in podiatry back then. There was nothing official. And he said, sure. He said, if podiatrists are going to treat infections, they better know how to treat them the right way. So he started pushing. Over the next year, he had to really push because he got quite a bit of pushback at Hahnemann. I mean, Hahnemann, at the time, there was an orthopedic surgeon. The guy who was chief of orthopedic surgery, Dr. Berman, of the Berman-Gartland procedure, hated podiatry. And he was like, this is a medical school. We don't train podiatrists here. And Dr. Lafrock, Jack, I'll call him, just ended up having to go to the president of Hahnemann University to get my fellowship approved.
Wow.
And he got it approved. I was paid as a PGY3, which was the first time I actually made a living wage. And I had that ability that I was honored to actually have a formal medical fellowship training in infectious diseases.
So you had one of the top opportunities to be trained surgically and the unique experience of infectious disease.
Well, yeah. And again, I thought I was going to be a surgeon, but one of the things that really opened my eyes is when I told some of my surgical colleagues, my attendings, so again, I venerated these people, like some of the top around, and I said, I just got offered this infectious disease fellowship, this incredible opportunity. I thought they would have been thrilled. And it was like, why do you want to do that? You're a surgeon. What are you going to do? How are you going to make a living doing infectious diseases? So I was like, it was some cold water being thrown in my face because I was excited about it. And I spoke with my parents. And they said they thought it was a great idea. It was a great opportunity. And, at the time I was making as a second-year resident $7,000 a year, I think. So I was living off their dime anyway. And I think they saw the opportunity to get me off their payroll because the fellowship paid $20,000 a year. So it's kind of like, no, take it. But no, in fairness, I had a lot of support from my parents and did have some support from others. And I just decided to go for it. And it was a leap. It was a quantum leap. But having that offered to me and working with Dr. Lafrock just really changed my entire professional life and personal life, for that matter.
And who would have thought it at the time, right? That was like a major jumping off a cliff.
Oh, yeah. No, we were all surgeons. We were all going to be surgeons. I was going to open up my own practice. There weren't big group practices back then. I was going to hang a shingle and I was going to do surgery and, be a foot surgeon. No, so that all changed. But boy, oh boy, it was an incredible opportunity, and I'll never regret it for a second.
Now, Warren, might be a good time to talk about mentors, because I know Dr. Lafrock was a mentor of yours. I found that one of the common themes in all of the doctors, whether they're deans or leaders in our profession, they've talked about mentorship and being shown the ropes by other people. Can you comment on mentorship?
Oh, yeah, I think it's absolutely critical. I listened to a couple of your podcasts and I saw that was a recurrent theme, that people who have been successful in their profession have one of the things they attribute their success to is having a mentor. And I was very fortunate. I had two throughout my professional career. Jack Lafrock gave me this opportunity and put his reputation on the line by having to go to the president of the university to get my fellowship approved. So that was mentor number one. And I had lost contact with Jack for a number of years. I just reconnected with him just a couple of months ago. We were down in Florida. He's retired now in Sarasota, Florida, where he had his practice after he left Philadelphia. And it was great. He's in his mid-80s now, but I had a chance to reconnect with him and spend some time with him and tell him again what he meant to me, both professionally and personally. So that was one. And after I did, or while I was doing my ID fellowship, I was approached by Dr. Harvey Lamont. Now, for those of you who don't know Harvey, he was at the time chairman of medicine at the Pennsylvania College of Podiatric Medicine. And he was unique in that he was fellowship trained in pathology, and he ran his own pathology lab. And he had this vision to start a department in podiatric medicine that was all specialist-trained podiatrists. Because at the time, podiatric medicine departments at the colleges were basically corn and callus cutters. They were the people who couldn't make surgery. They were the people who couldn't do surgery, couldn't make it as that, the cronies of the dean or whatever, the president of the school who needed a job. So Harvey had this belief that podiatric medicine and surgery encompasses more than just surgery, and that it is vascular disease of the foot, neurology of the foot, dermatology of the foot, rheumatology of the foot, in my case, infectious disease of the foot. So he put together a department of people who were fellowship trained in all these different medical specialties. And it was incredible. But he was also a bit of a taskmaster. He was the old school publisher Persh. Publications meant a lot to him because he believed that research and creating new knowledge was the only way a profession could survive. So he really pushed us to have to write. And I'll tell you, it was a bit of a pain at the time, but it got me learning how to write manuscripts and getting involved in research and writing, and it was just incredibly important. So, and in return for that, he was a bit of a taskmaster in that regard, but in return for that, he supported anything I wanted to do to develop my specialty in infectious diseases. Any book I wanted in ID, and go to an ID conference, he would have departmental funds pay for it. So he actively supported my becoming this expert in infectious diseases, as long as I produced for him. And it was a great give and take. And Harvey, again, he's also now retired and living in Florida, but, I keep in touch with him, and it's just so critically important. And I think, you know this, having been involved with education your entire career, that it's the number one thing we can do is to mentor students and to mentor residents and to get them excited and to give them some direction, even if they might not like it at the time.
We have to train up the next generation.
Absolutely.
So Warren, something that ties into the mentors, but you had the opportunity to give the commencement address at Barry University this year. And you also, while mentorship was one of the themes, I think one of the other themes was taking chances. And you've kind of illustrated that, but how would that play out in today's generation graduating? Yeah. What is taking chances? How do you define that in a career opportunity?
Well, first, I want to thank your friend of mine, Dr. Rob Snyder, who's dean of the Barry School, for inviting me to do that. I found it very interesting that one of the schools I have no connection to, I got invited. I mean, I graduated the Scholl College, probably done more than a lot of the graduates, but they've never asked me. Pennsylvania College, I'm not holding my breath, and we don't have graduation speakers at AZCPM.
That's correct.
Yeah, it keeps the graduation ceremony focused on the students. It's really nice. I like it, and short.
Both of those are priorities, I believe. Yes.
Yeah, but so one of the things, when Rob invited me to give this commencement address to the students, I think, what have I always thought about if I had to talk to the next generation? And it's always been in my mind these two things that I think define my career. The one is the mentorship, and the number two, or actually in the lecture I gave, or the talk I gave, was number one, was taking a chance. Thinking outside the box, because I was going to be a surgeon, and everybody else was going to be a surgeon back then. And when this opportunity came to train in infectious diseases, there were as I mentioned, there were a lot of naysayers. But because I had support from other people, family members, I decided this is something to try. But I think people are a little bit afraid. They get into that little niche that they think they're going to do, and they're afraid to think beyond that. But there are opportunities. I mean, I think in our profession right now, the unlimited potential in limb salvage, or according to Dr. Rogers, we have to say amputation prevention as opposed to limb salvage. But it's, that's where our profession should be. And we need to have our students think that this is where they need to go. They need to go into diabetic foot care, amputation prevention, limb salvage, whatever you want to call it, wound care. I mean, you've been involved in wound care your entire career, as is Dr. Snyder in Miami. And this is something that it's not what most of our people think of when they come into school. Every student I have interviewed, whether it be way back when at the Pennsylvania College or now in Arizona, what's the first thing they say? Why do you want to be a podiatrist?
Surgery.
Absolutely. I want to do surgery. It's like, nurse, glove me. You know?
And number 2, sports medicine.
Yeah, we hear a lot of sports, and I'm okay with that. You know, we need more people for sports medicine. So I think that that's really an important thing. And these non-surgical, these medical specialties. You know, a former student of mine who has really surpassed anything I've done is Dr. Tracy Vlahovic at the Temple School of Podiatric Medicine. And Tracy is fellowship trained in dermatology. Well, she lectures all over the place. She's lectured internationally. She lectures all over the country on treating dermatologic problems of the foot. That's totally thinking outside of the box when she was offered this chance to train in dermatology. So I think the students have to keep their minds open and keep their eyes open to potentials when they're doing their residency, when they're training. And I think that some things might interest them that they didn't think would have interested them when they're sitting in the class. I did journal clubs this morning with the new second-year students. They probably all think they want to be surgeons, but hey, give them a couple of years.
Oh, absolutely. You know, Warren, when I first was aware of you in the profession, I was a student and then a resident, and I would carry around this little red book called the Handbook of Lower Extremity Infections with your name on it. And you're talking 1991, you published your first book, right?
Yeah.
Warren, writing books is a lot different than writing manuscripts or book chapters. And I am so impressed that you did that 30 years ago. How does one take on the daunting task of writing a textbook?
Yeah, I love that you mentioned the little red book, because I'll never forget one of the great surgeons in our profession, and unfortunately died way too young, Dr. Gerard Yu, who is of Chinese-American descent, once at a meeting held up my book and said, "You should all get this book and you should listen to me because I know about little red books."
Oh, that's funny.
Yeah, that's a Mao Zedong reference. So, yeah, what happened is there weren't a lot of books. In fact, I can't. There was one hardcover book out there in infectious diseases of the foot and ankle from a podiatrist doctor, Dave Marcinko, down in Atlanta, and it was a hardcover book, and lots of chapters and written by lots of different people, if I remember correctly. And I had the idea that what our profession needed was something that was portable and something that was paperback and, like you said, could fit into a white coat, the pocket of a white coat. So I thought about doing this Handbook of Lower Extremity Infections, and the first edition might have been something like 200 pages. It expanded out to about 300 pages, but always was kept in a handbook format. And yes, I wrote every single word of that myself because I was young. I was probably foolish. I was energetic. And that book did more for me in getting my name out into the profession. Yes, I was doing a lot of lecturing, but just the fact that that book sold so well for a number of years, it was probably after Glamry's, surgical textbook, was one of the top-selling books in podiatric medicine. And I ended up doing 3 editions of it. The publisher for years has been trying to get me to do a 4th, but it's just, at this point, I'm 67 years old. It's just too much work. So if anybody's listening who's, got especially knowledge in infectious diseases, is young and excited and interested, hey, give me a call. We'll talk about co-authoring something.
I think that's great. And you're absolutely right. When I think back to, studying for residency interviews and resources during residency, McGlamry's, Joseph, Freiberg, Kaminsky. Those are my 4 books. And 3 of them were infection and diabetic foot related.
Yeah, sure. Freiberg and Kaminsky, sure.
Absolutely.
I remember those books well. And McGlamry's book was the textbook, was the surgical reference in our profession. So, no, thank you. I'm honored to be mentioned along with those other books.
Yeah, absolutely. Warren, before we start talking about social stuff, I want to make a couple comments on work we've done together.
Sure.
We did the checklist article, maybe 4 or 5 years ago?
Yeah.
After Atul Gawande's concepts of the checklist manifesto, right? For airplanes, and you're a pilot. We'll talk about that. But that was really fun collaborating. That was the first time we had a chance to collaborate together.
Yeah, absolutely. On something academic, other than working at the college. So, and our interests have always kind of meshed. because, you certainly have been involved in the wound world forever. And whenever you're involved with wounds, you're dealing with infections. So, and I, back when I was at Temple, myself and the late Dr. Tony Cadava were running the diabetic ulcer clinic. That's before everybody had a wound clinic and everybody was an expert in wound care. So we were treating ulcers, and I was treating ulcers my entire early career when I was there. So no, it was a great opportunity. And I think the more we get people in our profession and students upcoming and people outside of podiatry who probably need it more than people inside podiatry to understand the approaches to wound care. And the checklist was a great way to do it.
Yep, it worked very well. Warren, we also, at the school, the students are so excited about your evidence-based medicine program, but also the PodMed 2 program. We bring in like a who's who in the profession to talk about the diabetic foot, from David Armstrong, Dr. Freiberg, yourself. I mean, really an outstanding course. What have you noticed about the students of today that are different from the students of yesteryear?
Oh my goodness, it is a quantum difference. I've been lecturing even before you brought me on officially as faculty, back when Dr. Page was dean. Dr. Curtis, who runs the PM2 course, would have me come in and give some lectures, just kind of like as a favor. And I noticed even then, and my wife would come down with me. She's a physician assistant, and she would sit in the back, and I'd giving these pretty high level talks on infectious disease. They start out basic, how to diagnose an infection, but the students knew so much in terms of microbiology and pharmacology. I was talking to them about, gram positive versus gram negative and antibiotic resistance and different classes of antibiotics, and they could answer the questions. It was just incredible. And that is just, I think it's a testament to the program at the Arizona College, because these students are sitting in their first couple of years with the DO students. There's no differentiation. I mean, they're sitting right there, and they're taking the same classes, and the extent of their knowledge is just mind-blowing. Now, I can't speak to the other schools. Well, I could speak to Temple and what I experienced, but that was 20 years ago, so it's not fair comparing. But the students of today are coming in, and they are incredibly bright, incredibly well prepared, and really, really motivated to do a good job.
They are phenomenal. And I always tell them the best indicator of you passing boards is just to get through the curriculum. And it's hard work, but our students step up to the plate, and like you said, they compete day to day with the DO students and do very, very well.
Yeah, I was giving the journal club in the evidence-based medicine course. The last 3 weeks are journal clubs, one on diagnosis, one on treatment, and one on systematic reviews with meta-analysis. And I split it up with 2 other faculty members, so we run these sessions. So I was sitting in a room with 3 groups of students. So there were 10 students in the room presenting 3 different papers. And they were critical. These are end of first year. They're brand new second years. They just finished their first year. They were critically taking apart these papers that they selected. I'm kind of like, well, why did you select it if it's such a terrible paper? But they were critically taking apart these papers and really academically thinking about them. Now, they didn't understand all the fine points of it, but it's just amazing the critical mind they have. And one of the papers had been published in JAPMA, to which I've been editor, as you mentioned before. And they start taking apart this paper in JAPMA. And fortunately, I had looked into the whole history of the paper, and I knew who the reviewers were and how it got through. And I said, well, hold on a second, guys. Now I'm being taken apart by a bunch of second-year students. I mean, come on, cut me a break. But yeah, they're just really critical thinkers.
Yep, super sharp. Yeah. And it's always fun too, because once they get that baseline of basic sciences and then they get into the clinical years, they've got inquisitive minds. They're always asking questions. And then you and I have worked so much with them with the student-initiated scholarship program. I think we have 54 students involved in that the last few years. And your input has been phenomenal, so thank you.
Thank you. This is a big commercial for the Arizona College and working together, but hey, I think it's great. Anybody who's listening, who's thinking about coming into podiatric medicine, Midwestern University, Arizona College of Podiatric Medicine.
No argument from me.
Do I get a raise now?
Sure.
Okay.
All right, now we're going to move into the fun stuff. All right. Warren, you have an eclectic background. And the first thing I want to ask you about is being an airline pilot.
Oh, no. Never an airline pilot. Private pilot.
I'm sorry, my bad. Private pilot.
Yeah.
And you're your interest in aircraft, and it may tie into a little bit of your ham radio.
Yeah, that's one of
passion.
the talk about shot put and ham radio. I mean, these were magnets to the young women back in the day. Let me tell you,
that's the motivation.
Yeah, no, it's exactly the opposite. I would have been a sprinter and into art or something. But no, I grew up around airplanes, a private pilot. My father was a private pilot, and he was very accomplished. And we used to take all of our family vacations in small airplanes. So, we have these little 4-seat or, 6-seat, either Pipers or Cessnas. We went through a couple of the different ones. That was when flying was a lot more affordable. But yeah, we would sit in the front seat. I have two brothers, and my brothers and I would split on each leg, sitting in the right seat while my father was in the left seat. So we learned all about navigation and radio communications and all of that. So it was actually during my residency, I think, I needed an outlet, something outside of podiatry. So about 1982, 1983, I started formally taking lessons, and I ended up, I've since multi-engine and instrument rated, but I'll tell you, it's one of those things that unfortunately have fallen by the wayside. As you get older, I'm not just as comfortable, flying as I was, and I'm not current anymore, but it was really a fabulous hobby. I mean, it's kind of expensive now to do, but it's just been a lot of fun and something that I've always enjoyed. And when I look at these beautiful skies we have up in Arizona, except, by the way, the reason I'm casual today is because it's 115 degrees outside.
That's right.
I wasn't going to put a sport coat on like Dr. Jensen here. He's got long sleeves, starch and everything. I don't do that.
Jeff.
Oh, okay, Jeff. All right. So, anyway, so I look at the beautiful skies here, and especially in Sedona, where I'm fortunate enough to live. It's just God's country. It's one of the most beautiful places in the world, and it would be really nice to fly up there again. But I think about it, that's past my time for that, though.
So you traded in an airplane for a Can-Am Spider, 2 of them. I can just see you and Judy cruising around the mountains. That's your Spiders.
Yeah, that's what we do. Yeah, for those of you who aren't familiar, the Can-Am Spider is a 3-wheel, almost like a motorcycle, with the 2 wheels in the front and the 1 in the back, not the traditional trike like the Harley trikes you see that have the 1 in front and 2 wheels in the back. These are specifically designed. I used to ride regular motorcycle. I would ride a regular motorcycle, and my wife hated it. Even though I was very cautious, I took multiple courses, skills courses, and I'm what's called in the motorcycle world, we're what's called ATGAT, all the gear all the time.
I like that. Yeah,
full face helmet, full body armor, the whole routine. And I always was, even when I rode 2 wheels. But what happened is I found that especially in the traffic, back east or out here, even in Sedona, I'd be in traffic, and holding up an 800-pound motorcycle at a red light is not a lot of fun. So we started investigating other ways to go, and I had taken a test ride on one of these Spiders a number of years ago and thought it was interesting. And when we moved to Sedona, I said to Judy, it would be great to have a Spider here. She said, well, you know what? If you're going to have a Spider, I am not going to be your biker babe sitting on the rear.
Good.
I'm going to learn how to ride. So I said, you serious? Yeah. So we both took, the Motorcycle Safety Foundation offers a 3-wheel riders course. They also do most of the training for 2 wheels, but they also do a 3-wheel riders course. So we both took the course, and I knew I was in trouble after she did the first lap around the parking lot course, and this dumb grin on her face. I said, okay, I'm screwed here now. I'm in big trouble. So, we got a Spider, and I decided to get back into a 2-wheel motorcycle. I got another motorcycle, and after about a year of that, I was like, what am I doing? So we actually got a second Spider. So the 2 of us, we go out this time of year. We end up having to go out like 6:30 in the morning, and we go up to Flagstaff, which is always a great ride up the canyon, up Oak Creek Canyon, which is gorgeous. Or we just ride around, and we have a couple of nice little loops we do. So it's just fun. It gives something to do.
Yeah, it looks like a blast. When we've been up to your place, we always see them in the garage, and I want to jump on one and go.
Well, take the course, come on up, try it. I mean, it really is a lot of fun.
I may just do that.
And it's a lot safer than 2 wheels.
Yeah, I can't even imagine 2 wheels, to be honest with you, Warren.
No, not, we've all treated enough motorcycle accidents, and I was confident enough in my skills, but the problem with when you're on 2 wheels, or even 3 wheels, or even driving a car for that matter, it's the other people.
Absolutely. They don't see you.
That's right.
They're looking at their phone or something.
Right. And at least the spiders are large, so they're much more visible.
Good point. So we touched on it just for a second. What's the ham radio fascination? Because I find that interesting.
Yeah, one of the probably nerdiest hobbies in the history of mankind. But I started this when I was 13.
Okay.
And back then it was, high tech to be able to be a ham radio operator and learn Morse code and be able to communicate all over the world, either using Morse code or voice. And I just stuck with it. It's just something that I've stuck with throughout my entire life. There are a number of different classes of licensure that you back in the day, you had to take Morse code tests, up to certain speeds. And then on top of that, you had to take a written theory test about radio theory. Oh. So I'm at the top. What's called an amateur extra. I had to learn how to do 20 words per minute, receiving and sending Morse code. Again, they got rid of that requirement because it was people were too freaked out by it. So now there's no Morse code requirement. But it's just fun. I mean, I can talk to people all over the world. Yes, you can do that with your cell phone, but just to do it on through the radio waves and have to deal with bouncing signals off the ionosphere and learning about propagation. And it give you a cool thing. Just about 6 weeks, 2 months ago, there's a ham radio station on the International Space Station.
Really?
Yeah, most people don't know that. And most of the time, it's what's called a repeater. You send a signal up and it bounces back down and you talk to somebody else on the Earth. But every once in a while, almost all of the astronauts are licensed hams.
Really?
And when they have some free time, they actually get on the radio. And like I said, about 6 weeks ago, there was going to be a pass of the International Space Station. Some of you see it at night. It really is cool to see. It's just this bright light going across the sky. And it's traveling at 17,000 miles per hour, and it's about, 300-400 miles up. And with a very modest, what people would think of as a walkie-talkie, we have a more formal name for it. And as the little modest antenna, I figured I would, try to work through the signal through the space station. One of the astronauts came back to me.
No way.
And it's like, and they always do the same thing. It's like, welcome aboard the International Space Station.
Oh, how fun.
So, I mean, in 50 years, I've never been so freaked out, excited in my life about something. I actually worked an astronaut 300 miles up, traveling 17,000 miles an hour using a little handheld radio. I mean, come on. I mean, that's just cool. Even for those of you who might be jaded, that's cool.
I think that's very cool. Very good. So this may seem a little ironic, but not really. You're the editor of the journal for our profession. So it's no surprise that you're a prolific reader. Oh, yeah. Well, I mean, when I'm not burnt out from reading all the articles for the journal, I've got to say, the journal, as you mentioned before, it's been 30 years, and the journal's doing really well. We get lots of papers. I mean, the volume of papers has skyrocketed from when I took over. When I first started, like I said, 30-some years ago, I think Dalton McGlamory might have actually been the editor I took over from him. Yeah, very good. And the journal was hand to mouth. Paper would come in, pretty much get accepted and get published. We have about a year backlog now. We have so many papers, and they're coming from all over the world. So I'm always reading those papers. But I do like reading. I also like reading for pleasure. And more than that, as we talked about, I'm a big audiobook fan. Good. So am I. That's great. Yeah. When I go back and forth, between Sedona and here, it's a 2-hour ride. Sure. So we have to listen to something, my wife and I. So at any given time, I've got an audiobook I'm listening to. I've got an audiobook my wife and I are listening to. So when we're in the car together, and frequently I'll have another book I'm reading also on a Kindle. So yeah, I just think reading is fundamental. Isn't that what they used to say? Absolutely. Well, it's a great way to experience the world without actually being there. Oh, yeah. Or times in history. Times in history more, because we love travel. I know you travel a lot also. In fact, we're going to Europe again in October. After our November Europe trip, our cruise was kind of didn't work out too well. Both got sick. Oh, I remember that. Yeah. So it was kind of a waste of a good cruise. So it's like, why not try it again? So there you go. No, but so we do like travel, but I think back in time and experiencing other times, places. I like biographies. So read some great biographies. I like historical fiction also, but I also like a lot of the contemporary junk novels. I mean, give me a Jack Reacher novel any day. There you go. It's just fun adventure, sort of thriller stuff. What are one of the classics that resonated with you?
Yeah, I think you're more of a classic sort of guy. We were talking about some of the books we read, and you're reading Tolstoy and Dostoevsky and things. That's very, very highbrow. I can't really think of one. I will tell you a book I've read recently that I thought was one of the most incredible books I've ever read. And I've talked to a number of other people who've read it. It's called A Gentleman in Moscow, by Amor Tolls, his name is. He's got 3 books out, but A Gentleman in Moscow was really unique. And it's a what I call quiet book. I listen on audiobook, I listen to the adventure sort of books, the thriller books. I read the more literature-y books. And I read it, and it's just about a guy back in the early days of the communist revolution in Russia. It's fiction. Who is just, because of his political views, is isolated into the Metropole Hotel. And he's not allowed to leave. Oh, really?
At the Metropole, yeah. Many years ago.
Okay. Well, he's not allowed to leave. You could leave. And it's just his life inside this hotel and so it's not a lot of action. But it's just so beautifully written. And everyone I've talked to who's read it said it's one of the best books they've ever read. Wow. And my wife still hasn't read it. She has it. Even my brother is now listening to it on audiobook. And she said, I'll get to it one of these days. I think it's one of those things, she's heard so much positive about it. She just doesn't want to read it. It's like she keeps telling me I've never seen The Shawshank Redemption.
I haven't either.
And I think that ticks her off that, it's supposed to be one of the best movies ever. And I just say, no, I don't want to watch it.
Gotcha. So
she's doing this to me with A Gentleman in Moscow. But for anybody listening, check out that book. It's really incredible.
Thank you. I'll put that on my list.
Yeah.
So let's talk about another artistic thing you like, Broadway plays.
Yeah, I'm a theater geek. I'm a 100% theater nerd. I read everything I can about Broadway theater. Having been born and raised in Philadelphia, we have a big theater scene in Philly, and plays that used to go up to New York would actually try out and start in Philly. And my mom was very into theater also, very active. She wasn't active in it, but she really enjoyed it. So she used to take us to theater all the time. And I think that's how I developed my love of theater. And musical theater in particular, I'm just totally enamored with. And it's a shame because we would go up, it's only an hour and a half up to New York from Philly, where we live in Philly and north of Philly. And it's easy to get to, but we haven't been since before the pandemic. We're spending more time out here in Arizona now, and it's a little bit of a wasteland, but I still keep up on all the goings on in Broadway. And I'm going to be back east for 3 weeks, starting next week after the APMA National. And I'm hoping maybe we'll get up and catch a show. But, so I tell people, if it weren't for podiatry, what would be your ideal career? I said, I would love to be in musical theater. Trouble is, I can't sing, I can't dance.
It's like being a basketball player that can't run.
Exactly. I mean, so the only thing, the lectures I give are my version of theater.
Got it.
Those of you who've heard me lecture know that I'm animated. I jump around a lot. I modulate a lot, and that's, to me, being in front of an audience, whether it be scientific or I guess it would be, artistic if you were in theater, is just an amazing experience, amazing feeling. So that's my surrogate. My lecturing is my surrogate for being in theater.
I like that. The apple does not fall far from the tree. Your father was a pilot and your mom was in theater, and look at you.
Well, my mom was interested in theater. She wasn't involved in it because she couldn't sing or dance either. But no, you're right. You are a product of your environment, and that's where we all develop something from that. Even though neither of them were in medicine, right. Neither of my kids are in medicine,
right?
But hey, you can only hope.
Oh, there you go. So I have a question for you. I've seen you lecture so many times, Warren, and you're phenomenal, and you're animated, and you're entertaining, all the things that we want to see when we go to a meeting, right? Because medicine could be, at times, a little on the dull side. How many lectures do you think you've given over the last 30 years? Ballparkish. Oh, my God. I can't even begin to imagine. I mean, of course, it's slowed down over the last couple of years, the pandemic, but even before that, just slowing down a little bit. But I've lectured in all 50 states. Okay. I think Wyoming was my last one to get. And you got it?
Yeah, I got it. Oh, sure. I ended up lecturing twice in Wyoming. I think once in Casper and once in Cheyenne. So, yeah, I've lectured in all 50 states. I've lectured internationally. At my peak, I was doing 100,000 miles a year on different airlines, American, US Air originally, now then American. For about 20 years, I was doing 100,000 miles a year. I was away maybe 2 or 3 weeks out of the year. I'd be out somewhere lecturing. They'd be quick trips in and out, but God, Jeff, I can't even begin to imagine how many lectures it's been. But I really enjoy it. The travel has become a problem. I just don't love the travel anymore. I mean, I'm dreading even next Thursday night heading out to the APMA National. The only flight's a nonstop in the afternoon, 4 p.m. from Phoenix to Nashville. Summer afternoon travel, not fun.
Do you ever get any butterflies before you lecture anymore?
Oh, God, no. No, I've never. The glossophobia is the fear of public speaking,
yeah. And
I mentioned that in my speech at the Barry School, and it is the number one phobia people have. It affects something like 80% of the population. I've never had it. I can speak to one person. I can speak to 1,000 people. It does not bother me at all. Now, get me on a balcony more than like 2 stories up, and I won't get any closer to that balcony any closer to the railing of that balcony than about 10 feet. I can be in an airplane because it's enclosed, but open heights, no. So everybody has their their thing.
Sure.
I have no problems public speaking, but heights, yeah, not for me.
So this is kind of an interesting question. I realize that topics of discussion change over periods of time, but what was the most exciting time in your career in infectious disease when you were on the podium talking about groundbreaking things?
Well, a lot of that's now. I mean, there's been, just in the last 7-8 years, there's been a tremendous amount of literature that's come out on osteomyelitis.
Okay.
I always used to love lecturing on new antibiotics. I've been an antibiotic nerd my entire career. I sit and read antimicrobial agents and chemotherapy and clinical infectious diseases, and I would go to all the antibiotic meetings. So I love new antibiotics back in the day when it was like weekly new ones would come out. Now, new antibiotics almost never come out. So that was always exciting to me, keeping up with all the new antibiotics. But now the work that's been done in osteomyelitis is just unbelievable. Whereas, we didn't have good literature on osteomyelitis until 8 years ago, 10 years ago, maybe. And people like Fran Gaiman, William Jeffcoat out of the UK, Javier Aragon Sanchez, and Lazaro Martinez in Spain and the Canary Islands. There's just, the work Larry Lavery has done on osteo, some of David Armstrong's work in osteo. There's just been some incredible work on osteo now showing that everything we thought was the way to treat it, the so-called, it doesn't matter where in the world I lecture or to what specialty I lecture. I say, how do you treat osteomyelitis? Everyone says 6 weeks of IV antibiotics. That there's no medical evidence, no human evidence anywhere to prove that's right.
That's even post-surgical resection, right?
Oh, yeah. They'll say, in fact, it's almost always post-surgical. It's, 6 weeks of IV antibiotics, post-aggressive surgical resection. And to this day, I was taught that 40 years ago, right, by somebody who was probably taught it 40 years ago. That's whisper down the line stuff. There's no evidence to support any of that. So now there's really strong evidence that we don't need IV antibiotics. We can use oral antibiotics. They work every bit as well as IV. There's evidence to show that you don't necessarily need surgical debridement. Sure, if you can, absolutely do it. I know you're talking about having Dr. Barry Rosenblum on, who I think the world of, and his work in diabetic foot up at New England Deaconess. And is he Boston Medical now, or is he still?
It's Beth Israel.
Beth Israel, okay. Yeah, Deaconess Beth Israel, yep. Where he's been for forever. And, yes, he talks about surgical resection of bone. And absolutely, if you can resect the bone, do it. It keeps me from having to give the patient antibiotics that are then going to blow out their kidneys probably because their patients are already compromised.
So there's a continuum there. It's not this or this.
No,
it's a lot in the middle.
Yeah, there's a lot in the middle. Just realize that just because if you resect the bone, you don't need any more antibiotics. We've published that in the Infectious Disease Society of America, and the International Working Group also said the same thing, that if you resect the bone, you only need to treat for a soft tissue infection. Yet your ID people will come in and say you need 6 weeks of IV antibiotics. And then they use a combination of vancomycin and piperacillin tazobactam, which is guaranteed to cause acute kidney injury. Studies have shown 5 to 7 fold increase in AKI in patients who are given vancomycin. I'm finishing a paper about that now, in fact, reviewing that. So there's just, a lot of things that have been changing in the world of diabetic foot antibiotics, osteomyelitis, and it's kind of cool to stay up on that. That's what I really enjoy lecturing on that. Now, just as a plug for my lecture next Friday at APMA, this won't be out by then probably, but I'm lecturing on turbinafine resistance and onychomycosis. There's some incredible work that's being done now around the world on resistant strains through a squalene epoxidase gene mutation, causing resistance to turbinafine, which has always been kind of our gold standard go-to for the treatment of onychomycosis against T. rubrum. So, there are things that are always changing. That's what's cool about evidence-based medicine, and that's why I limit the students in the journal clubs. The papers have to be no more than 5 years old. Right. Because things change on such a rapid basis, and you just have to keep up on it. And there's always something exciting, always something. I still, every Monday I get my emails from PubMed, my NCBI, and I get an email with all the papers that have been published the past week in osteomyelitis, diabetic foot infection, and onychomycosis. And I go through every one of those emails and I look at all the abstracts and find out what's going on in the world. Wow. It's you always have to stop. If you stop learning, you're like a shark who stops swimming. How about that? You could put that up on the.
I like that. That's a nice little metaphor for practice in medicine.
Yeah, I think so.
I like it. So what's next for Warren Joseph in the world?
We've got this trip coming up that we're really excited about. Cruise. Starting in Bergen, Norway, ending up in Barcelona, going down the west coast of Europe, and then we're going to fly to London and spend 4 nights in London. We're big Anglophiles. We watch all the British TV, all the comedy panel shows. The Brits do comedy and talk shows better than anybody.
When I think of British comedy, I think of Benny Hill.
Yeah, that just dates you.
I know.
Yeah. Yeah, no, Benny Hill was way slapstick. I mean, he's brilliant, but it was way too slapstick. Now they do a lot of political commentary stuff. But so, we're going to a show in London. London is known for the West End, and there's shows in the West End. So we have tickets already.
I think I saw Wicked there.
Okay.
Yeah, so it was beautiful.
Great show. And so we have tickets for a show in London in the West End. And, but other than that, professionally, I'm very fortunate that we live in a beautiful place, and I've got the ability to work with you and work with the students at the Arizona College, and I'm still doing the journal, and I still lecture. I'm still going out and doing lectures, either CME lectures, and I do work with the pharma industry. Just got approached about a new protocol for a new antibiotic for diabetic foot, developing research protocol for a new antibiotic. So, I keep busy, but I also learned an important word that is very, very important when you get to, this age. And it's a simple word. It's only 2 letters and starts with an N.
Absolutely. That's the best word in the world. Yeah.
And, when you're young and you're early on, and you're afraid if you say no too much, they're just going to stop calling you. And you're self-employed. After I left the college in 2000, so 23 years ago, I became fully self-employed. I didn't have a paycheck coming in. So that's, you can't say no, but now it's nice. And I get invited to come and give a lecture in Lafayette, Louisiana. No. And no offense, Lafayette, Louisiana, but I'll take the 115 dry here. Did you see that new DiGiorno pizza commercial they're doing on TV? So DiGiorno Pizza is doing a new commercial that, at the end they talk about the rising crust pizza, and then they cut to a shot of Phoenix, and they say, "Unlike you, we bake in dry heat."
Absolutely. You know what? I've said that for years. When we lived in Florida, the weather's horrific in the summer, right?
Terrible.
Hot and humid, and you're dripping. But at least you have a mechanism to cool yourself off. Here, you just bake your brain.
You know what? I'm not looking for it. Nashville's going to be hot and humid.
True.
Philly, 90 degrees and 75% humidity. Here we're, 100. Now in Sedona, it doesn't get as hot as, we're 15 degrees cooler than Phoenix. But even when it gets to 100, your dew point is 15 and your relative humidity is like 5%, I'll take that any day, because when we wake up in the morning, it's cool and it's dry and it's beautiful.
Absolutely. Every day is beautiful here.
Yeah, I mean, I like it. Other than when you call me down to do a podcast in 115 degree heat.
We had a good lunch, though.
Yeah, that's true. Thank you for that.
You're welcome. Well, Warren, I anticipate we'll do this again in the future.
I talked about everything. I don't know anything else to say.
Well, we can dive into more medical stuff too.
Oh, okay.
You know, today the mission today was to see what makes you tick. So I think we accomplished that.
All right. I'm glad.
And I wanted to thank you for driving down here in the heat, your time, your expertise, your energy. Thank you. And I think that in the future, when we get back here, maybe we'll have different technology. We don't have to come all the way down here. We'll just do it from home or something.
No, that works. We do come down to the valley. We have to do Costco runs every once in a while.
And you got to come down to the school.
Right. I was teaching today anyway.
Yep,
so
there you go.
That worked.
Well, and to all of our listeners, thank you once again for tuning into Dean's Chat. We certainly appreciate you listening on Spotify or Apple Podcasts. And please give us a 5-star ranking. And then if you're watching on YouTube, we love to have subscribers, so do subscribe. And Warren, I know you got one of these Dean's Chat cups.
Oh, yeah. Wonderful.
I close out every episode. I close out with a cheers.
Oh, I left it in the other room. I'm sorry.
That's all right. Cheers, everybody.
Cheers.
Bye-bye now.